So today our topic is concept of prevention. So in previous classes we saw कि हमारा disease transmission how does it occur, how does it transmits from one person to another. So today is concept of prevention. Prevention means how can we prevent from having the disease, or how can we prevent the people from having the disease as public health professionals, right? So prevention main aim is to promote well-being of the person, protect him or her against emerging threats, and restore health if compromised. So it is a dynamic process that integrates scientific knowledge, community engagement, and strategic interventions to reduce pain, disability, and premature death. So prevention serves as a cornerstone for public health and clinical practice. So for this, we should know the full natural history of the disease, but because there is no single known cause for any disease, like we saw the web of causation multifactorial model of diseases. So often eliminating only one single known cause can effectively prevent the disease and can effectively uh, put a very good impact on the people's health. So it is very good if we can eliminate only one single known cause for a disease. So successful prevention requires the understanding of cause of disease, dynamics of transmission of disease, identification of risk factors, high risk groups, availability of prophylactic measures, early detection tools, treatment options, interventions, and there should also be good monitoring, evaluation, and refinement of all the strategies. So there are various levels of prevention. Levels of prevention means we can prevent the disease at various levels. At various levels means first one is primordial prevention. Primordial means that we can focus on preventing the emergence of risk factors. If we are controlling the risk factors, the disease will not progress. So we are targeting social, economic, and environmental determinants in this type of prevention. For example, promoting healthy lifestyle norms in children to prevent future obesity or hypertension. Next one is primary prevention. Primary prevention is to prevent the onset of disease by controlling the risk factors. Means the risk factors are already present in the individual and we have to control them so that the disease may not onset. For example, providing iron supplements to prevent anemia. And how can we do it? By the health education, by immunization, by giving nutritional supplements, and environmental sanitation. Third one is secondary prevention. Secondary prevention involves early detection and prompt treatment to halt the disease progression. Means the disease has already emerged, the disease is already present in the individual, the symptoms are coming. So we have to early detect the disease and give the prompt treatment so that it may not progress to the disability criteria. So treating mild anemia in children before the complications arise, and it includes what? Screening programs, diagnostic testing, and early therapeutic interventions. Fourth one is tertiary prevention. Tertiary prevention means now we have to just focus on limiting the disability and rehabilitating the individual with established disease. So it aims to restore the function, improve the quality of life. For example, physiotherapy is the rehabilitation for various types of patients. For stroke patients, or we any person having chronic illness, any person having the injury, any person having the fracture, uh, to rehabilitate the person, physiotherapy is given. So here we have certain in detail prevention types in detail. Like in this we have, since lifestyles including smoking, eating habits, and physical activity are developed throughout childhood, so many adult health issues have their earliest roots. So primordial prevention means we have to prevent it from the childhood so that we the future, when they will become the adult, they may not have the issues. Primary prevention, action taken before the disease is onset and eliminates any possibility that disease will ever occur. So We have general health promotion, health education giving, improving the nutritional part, encouraging the physical activity among the individuals, promoting the mental well-being. And if certain protective measures have been should be taken, then it should be promoted also. So immunization, having safe drinking water, fortification of foods. So these are all the prevention strategies. Then, primary prevention is not limited to avoiding the illness, it is just the concept of positive health. If we are having the positive health, then we will not develop certain diseases. Particularly, we are talking of the chronic non communicable diseases, the lifestyle diseases. And lifestyle diseases are coronary heart disease, hypertension, cancer, and today diabetes is also in this list. So interventions focus on removing the risk factors. So no tobacco use, unhealthy diet, no unhealthy diet, physical inactivity should be means not promoted, like a physical activity should be promoted, and excessive alcohol consumption should be means it should be prevented. Then for primary prevention of chronic diseases, WHO has recommended two approaches, right? We are talking of here we talked of strategies, right? These are the strategies. Primary prevention strategies includes general health promotion, health education, and having specific protective measures. But WHO, because it is like have the global perspective, so it says that we should have the two approaches. Like we can have the population strategy. Population strategy means the entire population should be covered as a whole, and then we should have the strategies to control prevent the disease. And number two is high risk strategy. So we'll take one by one. Population strategy. Population strategy is what? When it is targeting the entire population regardless of individual risk level. Means we have not bifurcated the individuals with the risk factors, or develop who is developing the risk factors, or who are at radar of developing the disease, but we are targeting the entire population irrespective of this. So we it is based on the principle that shifting the average level of risk factors across whole community can lead to substantial reduction in disease prevalence. Means for example, if we are promoting we are promoting yoga day, है ना, we are promoting world health day. So when these days are celebrated, we are targeting the entire population so that they may shift towards the healthy lifestyle things. So when the whole population will move towards healthy, like we are motivating people, we are motivating certain group of people, so they will motivate certain group of people who are in their contact. So this will develop a chain, and this will develop the whole community, motivating the whole community. And the thing is that we are covering the entire population. So in this case, the epidemiological studies shows that small reduction in average blood pressure brings a great amount of impact. Like if we are controlling blood pressure, the risk of developing heart diseases are reduced. If we are able to manage the and control the sugar levels of people by motivating them by walking, and by having physical activities, or by any type of hobbies they can opt, so the reduction of sugar levels will not develop the diseases like which are developing from it's like diabetic retinopathy, or certain heart diseases, or certain cholesterol levels may not also become high, because these are all linked to each other. Like so there will be significant decline in cardiovascular disease rates also. So this population strategy emphasizes broad based interventions which are aiming to modify socioeconomic conditions, behavioral patterns, and lifestyle choices. So these changes are designed to reduce exposure to risk factors and promote healthier living environment for all. So in this strategy, the key features says that there is no requirement of doing individual risk assessment. It is promoting universal health measures, and often it is implemented through public health policies, community wide education, and environmental modifications, legislative actions like tobacco control and food labeling. So, examples are reducing salt content in processed food, promoting physical activity through urban planning, mass media campaigns to discourage smoking, and fortifying staple foods. Then we come to high risk strategy. High risk strategy focuses on individuals who are at elevated risk. Means we have identified certain individuals who are at risk of developing certain type of diseases. So we are providing targeted preventive interventions to them. So this requires screening, this requires assessments, and this also requires the biomedical indicators which and the various tests and assessments, so that we can just bifurcate, or we can just have that group identified, and what are their risk factors. Means we can have a group which is on high risk of diabetes, we can have the group which is high risk of cardiovascular, then hypertension, then diabetes, or means certain type of individuals. So key features are, we are identifying the individuals, and it requires clinical precision. Then this is often used in settings where resources are limited, but still targeted action is more feasible than population wide measures. So examples are like prescribing statins to individual with high cholesterol, lifestyle counseling for people with family history of diabetes, and antenatal care for pregnant women with risk factors for low birth rate. Okay, so integrating prevention strategies means like, while each strategy, that is primordial, population, or high risk, it is focusing on every part of life, or various factors, but they are complementary and they are most effective when they are implemented together. So, holistic approach to primary prevention recognizes the interplay between agent, host, and environment. So, this triad forms the basis for pre-pathogenesis interventions. So, it should aim to prevent the disease before it happens, right? So, core public health practices in this primary prevention are sanitation and hygiene, infection control, immunization, environmental safety, and workplace hazard control. Next, we come to secondary prevention. Secondary prevention is what? When the action has to be taken which halts the progression of disease at its incipient stage. Incipient stage means the disease has just onset. Means the symptoms has just occurred. The disease is in its acute stage. So we are aiming to prevent the complications. So secondary prevention focuses on early detection, timely intervention to stop the disease progression before it leads to irreversible damage or complications. It operates through preclinical or early clinical phase, and it aims to restore the health and limit the transmission if we are talking of infectious disease. So components are early diagnosis and prompt treatment to be given. Objectives are, we have to just diagnose the undiagnosed cases, we have to interrupt the transmission cycle, we have to break the chain of transmission, and we have to give them dual protection. Means we have to go with primary and secondary prevention, both strategies. What are the implementation channels now? Now implementation channels means, how will we promote the secondary prevention? The promotion of secondary prevention is done through clinical medicine. Means early detecting the disease, giving the medicine, and so giving the treatment so that the disease may not progress. And this is also supported by certain government sponsored health programs, like we have national screening initiatives, we have school health services, we have maternal and child health clinics. So limitations and challenges are that this individual always experience mental distress, physical discomfort, functional impairment. So it is a very big challenge to a cert move a person from unhealthy lifestyle to healthy lifestyle. means to move a person from having mental distress, stress, and trauma in their life, and motivating them to certain things so that they become happy. So community may suffer loss of productivity, they can have increased healthcare costs, but these all are not so burden to the disease or community when the disease progresses to complication, means the complication should not occur and the community may suffer the healthcare costs. Then if we are making it cost effective, then secondary prevention is more expensive than primary prevention, of course, and it is less efficient in halting disease spread if we are comparing it to primary prevention. And it is always there. Primary prevention is always cost effective. Then comes the secondary prevention, then comes the tertiary prevention. Next is tertiary prevention. Now, tertiary prevention means we are preventing the disease from having the disability stage. Means we are limiting the impact of established disease, reducing disability, and enhancing the quality of life to the affected individual. So, if we talk of definition, it refers to all measures available to reduce the impairment and disabilities, minimize the suffering caused by existing departure from good health, and promoting the patient's adjustment to irreversible conditions. So, tertiary prevention comes when the disease is in its irreversible condition. What are its objectives? Then objectives are the complications should be delayed or entirely omitted from the deleted or just prevented from the individual's life, minimize the functional limitations, support the psychosocial and vocational adjustment, and promote independence and dignity. So various approaches, or you can say the interventions are, that is large stage treatment. Still we can progress, halt the progression of the disease and reduce the severity of complications. So for example, if a person is having diabetes, we can manage diabetic foot ulcers to prevent amputation. And rehabilitation services, they are initiated once impairments have been stabilized. We can also have the multidisciplinary approach when we are talking of tertiary prevention, because modern rehabilitation criteria is also there. So medical care is of course there, the treatment and the monitoring should be there, counseling should be given, the mental health services, the mental health support should be given. They should be given vocational training like skill development of or any job reintegration, so that they may have cool and calm lifestyle, and they should have the calm mental health. And of course the community support, the assistive devices and housing adaptations should be provided to them, so that they will not develop any type of mental health issues. So this is comprehensive care given to the individual when he has entered into the stage where the disease is irreversible. So this is broadening the traditional concept of prevention, means rehabilitation is the main thing, chronic disease management and palliative care in certain contexts of the individuals.